Welcome again. Today we will talk about the important problem that face a lot of men, and it is the premature ejaculation. Some rates said that it reaches 30% of men. Today we have a very important doctor, Dr. Alaa Abdalaziz Aglan. He is the first doctor that did a permanent surgery for premature ejaculation, and he also invented 3 surgeries on the erectile dysfunction. Hello.
At first, we want to know what is the premature ejaculation.
The book says that if the ejaculation took less than 3 or 4 minutes, that means they suffer from premature ejaculation. But if we want a clear definition, it is that the one reaches the trance before the other. The global rates say that the men who suffered from it reaches from 30% to 40%. Some doctors cut the nerve, and that is so wrong, because by that the men lose the sense. And it took 9 months till the nerve grow again. Then they cut it again. And that thing had 2 problems. First, this surgery is very expensive. Second, that maybe the cutting of the nerve had a response also. The other solution they goes to is pills or the creams, and a lot of people doesn't respond to the pills. So at my surgery I found out that some people doesn't respond also to the spray.
So, how you do the surgery?
Look, that surgery simply took 10 minutes. The patient leave the hospital after 4 hours. It consists of 2 parts. The first part is that there is 3 things affects the sexual action: the brain, the muscles, or the sense receptor. The main things of those 3 is the brain.
So, Dr. Alaa, there is a video you can also teach us on it.
So, that's our research that we made. It took 5 years from us, started from 6th of April 2011 to the 6th of April 2016. We made at least 1,000 surgeries with different techniques. We give the patient physiologic halves and started to cut between the penis and the construction to reach the bulb sponsus muscle. We made at least 1,000 surgeries with different techniques. We give the patient psychedelic halves and start to cut between the penis and the castration to reach the bulb sponsus muscle bilaterally and cut it completely, and identification of the funeral delta, then execution of it. This delta is like the G-spot on the woman. The red part of that photo is the sensitive part of the penis. So to convince the patient to cut the delta, we first let him put spray on the delta part before 15 minutes of sex. Then we found that it works very well. So we started to cut that part from the penis. There is some patient just want to cut that part and no need to continue the other surgery. And it works very well with them. So, how the brain affects the premature ejaculation? There is the sexual dreams, and the brain controls all of the process, and any dream just took 6 seconds, and the part that they ejaculate in just took 0.46 of the second. So, if the brain was the most controlled part during the sex, so there is a premature ejaculation. So, why we said that the muscle cause also premature ejaculation? There is the tract examination, there is a prostate examination. When you do a massage to the prostate, the premature ejaculation happened. They found that the nerve activation on the bulb sponsus muscle gets so active, then it increased the ejaculation process. So, what if the problem was that the nerve itself? There are some patients doesn't respond to the cutting of the delta, and if we did the 2 things together, it will respond. The rates reaches to 97% of men that heals.
So, doctor, how the idea of searching for solution to the problem comes to you?
Look, I noticed a strange thing. I found a lot of patients who comes to me saying that
they put a spray on the head of the penis, but with no effect. So I started with tissue examinations and found that the nerve that in the head of the penis isn't a fan touch, and found that the most sensitive part in the delta of the penis, there is the pulp sponsus reflex, that when a patient came like an accident and to see if he had an infection on his backbone or not, we push on the head of the penis, and when we do that, the muscle automatically contracts. And already at the sexual process, the vagina doing some contractions to the penis, then he ejaculated. So we started to cut that muscle. After that surgery, the patient who ejaculated before 1 minute, he became ejaculated after 6 or 7 minutes. 5 minutes became from 15 to 20 minutes.
And how long does the surgery takes?
It took only 10 minutes, and he can have sex after 3 months, and he can feel the difference during sex. There are 2 types of response. The one jump that he took from 10 minutes and reaches to 20 or 25, but that's not usual.
So doctor, if the patient have the heart diseases of diabetes, can he do the surgery?
Of course he can do it. The only thing that he cannot do, it is that he is under 15 years. And if he had erectile dysfunction, I will do the stent, then the surgery. There is a specific instructions for those who have done the surgery. I give him antibiotic and I give him some pills for 10 days. And he changed the bandages and cleaned the penis. He can't carry heavy weights the first 5 days, and no sex until 21 days, and in some cases 16 days. This surgery is a permanent surgery, and the man will be confident of himself. Thank you, doctor. You are a great Egyptian doctor. Thank you for that interview. Goodbye.